Today we will discuss about one of an endocrine gland, that is parathyroid gland. Parathyroid gland is located on the surface of thyroid gland. So there are four parathyroid glands and they exist in pairs. So first pair is situated on the superior poles of thyroid gland and another pair is situated on the inferior poles of thyroid gland. So there are four parathyroid glands. In parathyroid gland, there are two types of cells. One cell is called as chief cell or it is called as principal cell, and another type of cell is called as oxyphil cells. So the chief cells or the principal cells are seen abundant and they secrete parathyroid hormone. And oxyphil cells are larger in size and they are less abundant and their function is still unknown. So next we will talk about the hormone, the single hormone that is secreted by the parathyroid gland, that is parathyroid hormone or parathormone. This is the structure of parathyroid hormone. So here we can see different amino acid residues. So it is a polypeptide hormone. We can call it as a linear polypeptide hormones with 84 amino acid residues. Let's move about the functions of this parathyroid hormone. So it helps in bone functioning, that is, it helps in release of calcium and phosphorus, and it helps in kidney to reduce the calcium vitamin D activation, and it helps in intestines for the reabsorption and absorption of calcium and phosphorus. So we can conclude that this gland will increase the reabsorption and mobilization of calcium and phosphate molecules in our body, and it will increase the plasma calcium level by decreasing the excretion of calcium in the kidney, and it enhances the tubular reabsorption of calcium and magnesium in the kidney, and it decreases the plasma phosphate by increasing the phosphate excretion in urine, and also it increases the calcium and phosphate absorption from the intestine. Also, this hormone helps in muscle tone, that is contraction of muscle, growth of bones, and it helps in normal nervous activity. So it mainly depends upon the level of calcium and phosphate in our body. So there must be a balance between the level of calcium and phosphate in our body. So calcium level in the plasma is regulated by the secretion of this parathyroid hormone. And this parathyroid hormone is an antagonistic to calcitonin. So we can observe this image. The level of calcium in our body is maintained in homeostasis. That is, there is a balance in the level of calcium in our body. So when the level of the calcium exceeds or the level of calcium decrease from the normal level, we can say it is an imbalance in the level of calcium. So if it is increased or decreased, it causes imbalance. So when the level of the calcium increases, the thyroid gland will help to decrease the secretion of parathyroid hormone, and that helps in the deposition of calcium in bones. So when the calcium is deposited in the bones, that will help to reduce the level of calcium in the blood. And if the calcium level is low, the parathyroid gland will secrete parathyroid hormone. So there will be increased production of parathyroid hormone. It will help in osteoclast. So osteoclast are specialized cell that absorbs and removes the bones, and so that they will maintain the level of calcium level and make into a normal level and maintain homeostasis, that is maintain the level of calcium in our body. Next, we will move about the disorders that cause due to the improper functioning of this gland. So first we will look about the disorder condition, that is hypoparathyroidism. So hypoparathyroidism. So that is hypo, it is under production of parathyroid hormone. That is parathormone or parathyroid hormone. So this is a condition where there is an underproduction of this parathyroid hormone. So low parathyroid hormone secretion will happen. So this hypoparathyroidism depresses the reabsorption of calcium and phosphate from the bones, and so the level of calcium in the body fluids will be decreased. As the result, the bones will remain strong. So next we can see another disorder condition, that is hypocalcemia. Hypo, that is under, calcemia, that is calcium level. So it is caused due to low calcium level. So when there is low calcium level, it leads to muscle spasm, that is involuntary contraction of muscle, and it can cause very painful condition, and it is called as tetany. So it is a sustained muscular contraction in larynx, that is our vocal box, face, hands and feet. So here we can clearly observe that calcium molecules in the bloodstream, and in this hypocalcemia condition, the calcium level will be low in the bloodstream. Next we can see another disease condition, cyanosis, that is in infants and children. The muscular spasm of this laryngeal muscle is accomplished by the disease condition called as cyanosis. So we can observe cyanosis in a child by observing a blue or grey color of skin, nails, lips or around the eyes. So these are the disease condition. We can call it as cyanotic. So cyanosis, it causes in infants and children due to the muscular spasm, that is involuntary contraction of muscles of larynx. Next we can observe another condition, that is muscle twisting. From the term we can clearly observe that it is muscle twisting, that is it leads to the muscular spasm, that is involuntary contraction of muscles of hands and feet. So this condition is called as carpopedal spasm. So next disorder condition is hyperparathyroidism. So hyperparathyroidism. So that is overactive osteoclast cells are produced, and it will leads to extensive decalcification, that is extensive removal of calcium, that will result in softening of bones, fractures occurs frequently, and one of the factors for osteoporosis in old age is hyperparathyroidism. So hyperparathyroidism, here we can observe that the enlargement of these parathyroid gland. So when this osteoclast cell are overactive, it will destroy bone cells. So it will leads to softening of bone cells. Then the main condition of hypercalcemia. Next we will move about hypercalcemia, disease condition, hypercalcemia. So the main cause of hypercalcemia is, hyper means over, calcemia, calcium level. So hypercalcemia means higher blood calcium level. So we can observe that the small molecules here, that is calcium, when there is high calcium level, it is called as hypercalcemia, and it leads to the depression of our central and peripheral nervous system, and it leads to muscular weakness, constipation, abdominal pain, peptic ulcers, and lack of appetite, and feel depressed, and relaxation of heart during diastole. In hypercalcemia condition, the calcium will be deposited in the walls of arteries. So, and also in alveoli of lungs, kidney tubules. So there will be a tendency for the formation of kidney stones of calcium phosphate and calcium oxalate.